Are you ready to share your medical surgical expertise?
Do you have an exciting research project or innovative solution you want to share with your peers?
Now is your time to shine. Submit an abstract to present at the 2025 AMSN Convention in Austin, Texas, September 11th through the 13th.
Whether you have valuable insights, innovative practices, or compelling case studies, we want to hear from you.
To be considered, submit your abstract by Friday, January 10th.
To learn more, visit www.amsn.org. On this episode of Med-Surg Moments,
last week, I had an opportunity to talk to students, just sharing who we are, what we really do.
Of the different areas that I have been able to work and manage and be a nurse leader of, the teamwork in Med-Surg was like nothing.
But I always like to remind people, Med-Surg, I don't sweat any admission coming in because I've seen it all, done it all.
And you also recognize when it's not going right. You recognize early because you've seen it so many times. You become that expert.
I didn't get bored, and you always got to see something new.
Maybe our listeners would love if we each shared our favorite Med-Surg nursing pro tip. Mine is that your home
This is Eric,
Maritess,
Sydney,
Sam,
Neil,
and Laura. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
we're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is the truth about Med-Surg nursing for nursing students. So we definitely want to offer a very special welcome to all of the nursing students listening to this episode. If you're a nursing student or work with nursing students in any capacity, we truly hope you will spread the word and share this episode with other nursing students. We're also excited to welcome back to the show a regular guest co-host who by now you might recognize simply by the sound of her voice, AMSN President Marisa Streelman. Marisa, we haven't seen you since the AMSN convention, so why don't you get us started with a personal update and an AMSN update?
Thank you, Sydney. It's great being here with you guys again today. So for AMSN, we are just catching up on things after the annual AMSN convention and Med-Surg Nurses Week. We are really just starting to focus on our chapters. We are having a chapter webinar actually on how to start new chapters because we got a lot of interest on that at convention. So we got a lot of people coming up to us and asking us about starting a new chapter. And so we wanted to bring that information to all of our members. So we have a new webinar that we're going to be leading on how to start a new chapter and all of the steps needed to get that up and running. Also, we have been working on developing our CEs to be able to have those with our podcasts. So we will be able to have, with specific episodes, CEs that will be available for our members. That's another great opportunity for our nurses because we're always looking for places to gather our CEs. And then also our abstracts are now open for the AMSN convention for 2025 for our podium presentation. So anyone who is ready to submit their abstract, get those in. It will be open through January 10th. This is my last month as AMSN president here, or going into my last month here. And in January, I will move into the past president role, and Christy Regan-Hartman will step in as president for AMSN. So we have a lot of fun stuff, as always, for AMSN. Something new always going on, but it's just been a great time for me as president. I've really enjoyed it. And now moving on to immediate past president, I get to mentor Christy in her role. So very excited for that. Personally, my kids were in a local theater production this weekend, and so that was a lot of fun. Got to learn all about local theater and what that's like. Learning firsthand about going to all the fun rehearsals and all of that and the performances. It was a lot of fun. The kids really enjoyed it. And then also we got a brand new kitten and her name is Pepper. And so now that I'm not president and I don't have to run to quite as many things, we thought we could get a little pet. And so we got a kitten. And I say it's for the kids, but really it's for me. So
I love the name Pepper. I want to say, first of all, Marisa, thank you for your leadership. I still remember the first time we met in an AMSN convention. I don't know if you remember that. And I was
kind of lost. And then you said, do you need help? And I'm like, yeah, I'm actually looking where to do the podcast recording. And she's like, hi, I'm Marisa. I'm like, oh, you are the Marisa.
I do remember that. That was so fun.
And I really wanted to say thank you for your leadership, because leadership is such a hard, challenging role, I would say, but you make it look like it's so fun and easy to do. So thank you really for that. When it comes to personal updates, let me see. Oh my goodness. Our topic today is really kind of timely because last week I had an opportunity to talk to students, just sharing who we are, what we really do. I think that's really the essence of us being nurses, to share the joy, to share the bliss. It's perfect. I really enjoy doing that. Other updates, I wanted to share an adventure. My son and I is asking for Moulin Rouge since he was 9 years old. He wanted to watch the Moulin Rouge Broadway show at 9 years old. He's into theater. And so I told him, when you turn 13, we're going to do that together. And so he did not forget. 1 week before his birthday, he said, Mom, do you still remember you're going to bring me to Moulin Rouge? And I was like, but that's next week. And he's like, let's look for a flight. So that's what we did. We went to New York just to watch the Broadway show. And something cool, I actually had a bucket list done. I'm not sure if you know that you can put your pictures in Times Square. So I told myself one day I'll be in the billboard of Times Square. And I was able to do that during that weekend, and so fun.
Did you take a picture of that, Maritess? I would love to see that.
Yes, I actually did share a video. I took a video. It's so cool. It's T-Mobile. You can actually upload your photo and then they put it on Times Square. And then my son was like, see, Mom, you got your bucket list done. And I'm like, next time you need to be very specific. When you manifest something, I said, one day my picture is going to be in Times Square. It has to be one day I need to endorse a product and be in a Times Square ad, right? How about you, Laura? What's going on?
Sounds like you've got a lot going on. That's amazing. I'm actually going to be in New York on Saturday, so that just gives me something. Maybe I'll sneak down to Times Square and give that a shot. For me, there's been so many good things happening to me on the work front. I think I mentioned on a prior podcast that I was selected to do a podium presentation at the ANPD conference upcoming next year. So I am really, really excited about that and nervous because it's a 1 hour long presentation. Getting out of my comfort zone there a little bit. The other good thing is I did submit an article to the Med-Surg Monitor and they did accept it. So that should be coming in an upcoming episode of the Med-Surg Monitor. It is about palliative care. So I hope everybody gets a chance to check that out when it does come out. It's been a really great experience. The Med-Surg Monitor team has been so helpful. And I'm just really excited and I'm proud of myself for going for it. Sam, what about you? What's going on with you?
Well, personally, little Theo is very mobile now. So he is crawling all over the house, pulling himself up onto everything. So trying to assess what are the real hazards in my house and what are the fun things we're going to let him explore. He's on the dog water a few times, which is an adventure, but we're having such a great time with him. He's just such a joy and it's so fun to watch him learn things like every day. So in the work world, there's just been a flurry of things all happening all at the same time as per usual. Lots of strategic planning for 2025. We're already in that time where we're looking at the next year and trying to figure out what the plan is for different service lines, what kind of education that they're going for and what outcomes that they're searching for. So lots of work going on there. So exciting stuff, kind of wrapping up the year and getting ready for 2025. Neil, how are you?
Greetings, team. How are we all doing today? Sorry, it's been a minute since I've been on with you. Congratulations, Maritess, on getting your kid to New York and going to Broadway.
He wants to watch the Cabaret Kit Kat Club now. And I'm like,
I don't know that.
Wait. No.
I'm addicted, yes. It's very addicting, it's a great thing. I think that'd be neat if Laura gets up there and the next time I go visit my mom and we all somehow get on the Jumbotron at Times Square. That'd be kind of a neat, that should be our new background pictures for the show, for the website there. But personally, just bubbling with great news. Last time I had mentioned interviewing with High Point University. And so it's been a few weeks already, and I am a clinical instructor. And so it is very serendipitous that this is a student-based podcast. I'm going to tell them to make sure they tune in for episode 140. And it's been a great learning experience so far for both of us. They're great students. Our school is relatively new in nursing. We've only had our first class of 2. I have nursing fundamental students and they're first semester. So we're doing mostly softer nursing skills in the sense that we're not doing medicine yet. We're doing vitals, we're doing ambulation, we're doing hydration, ADLs, what I call the backbone of nursing. People don't realize how much we do physically. We don't need a prescription to have a patient have a great experience. So I'm very proud to be at High Point. It's been a great experience so far. And I actually recently took a trip out to San Francisco to enjoy a little R&R, and that was a beautiful trip. Other than that, getting ready for winter. It's been a little bit cold out here in North Carolina. Just doing the best to stay focused and finish with my kids through the semester and contemplate what might be going on for next semester if I'm going to continue with High Point. Sydney, what's been going on with you?
I'm so excited to hear everyone's got such exciting updates. For me, I think I said the last episode that I was on with everyone that I'm back stateside. So that's exciting to be in the same time zone as everybody. I made it to Rhode Island. I just checked into my new job a couple days ago. Kind of got settled, got computer access, all those kinds of things that you have to do the first couple days. And then I have a few days off now to get settled, get all my housing squared away. So all my stuff just got delivered. It's like a chaotic mess. You don't realize how much stuff you have until it's all laid out on the floor in front of you. And you're like, wow, I have way too much junk. So that's going to be my job for the next couple of days, is just going through everything that I own. Which is weird because I feel like I just went through everything I owned when I packed it away. But I'm excited to start this new adventure in Rhode Island and reconnect with friends and family. I did my undergrad here in Rhode Island, so I'm familiar with the area, but new exciting role as an ambulatory care nurse, seeing that side of what Med-Surg nurses can do. So I'll be excited to share that experience with you guys in the coming weeks. But with that, why don't we move on to our topic, the truth about Med-Surg nursing for nursing students. We're here to talk about what it's actually like to be a Med-Surg nurse. So who would like to get the conversation started?
Students really don't realize that Med-Surg is a specialty. A week ago, I had an experience with nursing students, and when I was asking them where they wanted to go after graduation, most of them are saying, I want to go to a specialty area. I said, what specialty area? They said ER, OR, behavioral health. And I said, the core competencies that you need to start with, the foundations, are within your Med-Surg competencies.
I know for me, when I talk to nursing students a lot of them have very, very, very big ideas and goals about what they want to do with their careers. And I kind of always tell my story about how I went into Med-Surg thinking it was going to be a foundation, like a jumping off point for me. And I figured somewhere in the future I was going to go to ICU or some other specialty, but I always wanted to get my start in Med-Surg. But once I started working in Med-Surg, I felt instantly comfortable. It was exactly what I pictured nursing to be. I was able to talk to my patients. I was able to educate my patients. I had a really good rhythm down. Even when I had those busy days with 5 and 6 patients, I was able to manage it very, very well. It was definitely very comfortable for me. And it was so comfortable that I ended up not leaving. I did move to oncology a little bit after my start, but Med-Surg has still always been my home. And I always tell nursing students that there's a place for everybody. I mean, don't be afraid to give Med-Surg a try. It might surprise you.
Yeah, Laura, I have a similar story as well, like getting through nursing school. And I came out of it thinking, I like Med-Surg, I like the ED, I like the ICU, I like women's and children's. Well, mostly just women's. Pediatrics terrified me, and it still does. But
me too.
But I felt like kind of the odd man out in my cohort of nursing students, because my class, I don't know if anybody else had this, but like kind of trends of what people liked. My class was all like peds oncology. And I was like, you guys are crazy, first of all, but bless all the nurses that do all that. But I felt like the odd man out, thinking like, I can go to Med-Surg, build a foundation, learn so much. Back then, which was like 9 years ago, almost at this point, like jobs were pretty few and far between. And you certainly were not going somewhere to the ED or ICU as a brand new grad back then. That was just not a thing. So I found a little spot in Med-Surg at the same place that I did my senior practicum, and I stayed there for 4 years and just absolutely loved it. Got my Med-Surg certification, charge nurse, some unit level leadership with professional governance, things like that. And I really thrived. I really thrived in Med-Surg and I loved it so much. And now in my educator role, I still feel like I'm in a place where I'm biased towards Med-Surg and that it's my favorite specialty and just always advocating that it is a specialty and something I think we're going to have to be talking about for a long time.
I think one thing that we don't talk about a lot and that I saw in the Med-Surg setting was the teamwork. Yes, there is teamwork on many of the nursing floors, but of the different areas that I have been able to work and manage and be a nurse leader of, the teamwork in Med-Surg was like nothing I had seen before, because you have to be that team that takes care of those very difficult patients, like with the psych diagnoses, and you have to come together and say, what's our plan for this patient? How are we going to handle this? How are we going to manage this? And you have to be consistent. Every nurse handling it the same way, shift over shift, time over time, again and again, to make sure we can get that patient out with the best outcome possible.
Yeah, some of my core memories of my time in Med-Surg was going to Chili's after a couple of hard shifts, and the stories shared over triple dippers and margaritas were unmatched. And it really is so much about the team, because there's really not a lot in Med-Surg that is very glamorous. We don't have cute, tiny little babies. We don't have a ton of crazy life-saving moments. I mean, there are some, certainly, but not on the daily, like in some other areas, things like that. And so the team is really, truly what could make it a really, really wonderful place to be and learn and grow and stay if that's what you want to do. There is absolutely no problem with that.
There was a spot when I worked night shifts a long time ago, equidistance between the two hospitals in town. So we were navy blue scrubs. I called that Smurf blue. And we'd all just converge there in the morning, and we all just kind of knew what was about to go down. A lot of breakfasts and a lot of conversations about the night. But I always like to remind people, except for ICU, you could think you're going into a specialty, but guess what? If there's an empty bed, if someone's there for acute kidney injury, you're going to get them, even if it's a cardiac floor. If you're a renal floor, you're still going to get somebody that's in there for pneumonia. If your floor is a specialty, but there's an empty bed and there's someone in the ED, you're still going to go there. So guess what? Med-Surg, I don't sweat any admission coming in because I've seen it all, done it all. That's the beauty of this Med-Surg experience, is that you're going to get so many experiences of small bowel obstructions, pneumonia, UTIs, acute kidney injuries. So when you come to a unit, you know what your day is going to look like. And somehow our wild brains handle all the different body systems as opposed to just one body system. We see everything that's going to come up to a floor.
You're absolutely right, Neil. You get to learn those routines for many, many, many different types of illnesses and injuries. You just know what to expect. You anticipate what the doctor's going to order. You know what the expected path looks like. And you also recognize when it's not going right. You recognize early because you've seen it so many times. You become that expert. The first year of nursing is always hard. I would pray on my way into the hospital and then cry on my way home during that whole first year. But when I realized that I had finally crossed that threshold, probably close to a year, where it didn't matter which patients I got. I remember walking in going, please don't give me this type of patient, or these type of patient scares me, or that doctor scares me. I don't want any of his patients. But when I got to the point where it didn't matter what I got, just give me my assignment. I'm going to go to work. That's when I knew that I had made it.
Laura, can I share that I even start with looking at who would be part of my team during that night, because I work nights. So I'd be like, oh goodness, I'm going to be working with her. Let me breathe 10 times so that I'm on the right vibe and that I would have the right energy for the night. I start with that, and then I look at who would be the physician for that night. And I'll be like, oh goodness, this is a good combination. How am I going to do this? And then I pray hard and say, you know what? There's nothing I can do. I cannot control this. You're going to get anything out there, something that you cannot control. But you have to remember, you have your resources, you have your team. I like what Marisa said a while ago, the teamwork. You have your team. Find the strengths of your team. Who would be the strongest team member? Okay, you know what? She's great in cardiac assessment. I think I need to ask a question about this. Let me go to her. My charge nurse is good with the sepsis bundle because that's her thing. And so without really looking at my checklist. Let me go check with her. I think that's what's important there. I also wanted to appreciate the time management and effective communication skills, because that's what I really learned when I was still at the bedside in the Med-Surg unit. Being able to block my time every 15 minutes, I have to do something and I block it. And then to have that very effective communication, that it has to be clear, concise, and consistent at all times. Because if not, you're going to forget what you said to this patient, to the other patient, and this patient. And so being that person to always do the same thing over and over becomes your expertise. And that's why it is a specialty.
Yeah, the multitasking, taking care of 4, 5, 6 or more patients in that med-surg setting, you really start to be able to hone those skills and the care management as well, and how to transition them, because a lot of our units would turn over half the unit in a day. You would get very quick at, okay, ready to go, Mr. Smith. I don't think in nursing school we always were taught how quickly you would be like, okay, all right, welcome one day, goodbye the next day, and here comes your next patient right in the door. I didn't get bored, and you always got to see something new. And it wasn't as rigid as some of the other areas of the hospital where you know that it's always the same. It keeps it a little bit more exciting.
When I get floated around, I do not like the renal floor, but majority of the patients there are renal. And so it's just like, is it Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday dialysis? Like I said, like fluid restriction, 1800. Okay. Low sodium diet. Okay. I was like, God, I cannot do this every day. I try to tell the students, especially with med-surg nursing, a lot of the floors that have that specialty aspect, there is like an algorithm almost of like what's going to happen each day. And I kind of try to open up their minds to see trends as opposed to just this hard kind of algorithm. Are we treating this medically or are we treating this surgically? Where are they in the disease process? Are we hitting them with 3 antibiotics a day? Our day's going to be busy. Put on your roller skates. If we're more towards that where they're getting only 2 antibiotics or 1 antibiotic, they have all their labs ran so we know what we're treating here. So this is where we should be pushing more. You're post-surgical. So now we're going to do antibiotics instead of spirometry. And so it's just kind of a positive chase the little rabbits down the rabbit holes of where we're going to go with it. It's not chasing the nonsense rabbit holes, because it starts getting, like I said, what are you going to do pre-surgery? Okay. It's going to be, you're going to treat it with meds first. Oh, the antibiotics didn't take care of the appendicitis. They're going to have to do surgery. Okay, we have to do prep for surgery. We're going to do post-surgical treatment of this patient. Then we'll have to teach them how to deep breathe and exercises. So it's just always so many different variants you can run off of it. So with Med-Surg, I feel like there's so many more opportunities for the brain to run your nursing mind through it, kind of really keeps it engaged.
Maybe our listeners would love if we each shared our favorite Med-Surg nursing pro tip.
About that.
Yes, I love it. Okay, so mine is that your home med list is a treasure chest. If you have an accurate home med list on your patient, you will learn 10 times more than if you ask your patient anything about their health history. So make sure you get an accurate one, understand why they're taking their meds. Lots of different meds can have lots of different indications. You will just find out so much helpful information from an accurate home med list.
My tip is really finding out what is the best way to communicate with your patient. When you're out there talking to the family members, talking to the patient, talking to your team members, I always want to remember when I speak, is it because I wanted to say it, or is it how they will understand what I said? I need to make sure that they understand what I'm saying, but also, is this the best way for them? Med-Surg is so fast-paced. People might say it's not really that fast-paced. It is, because you have to deal with so many patients and you have to do it quickly and decide on things very quickly. Having that foundation of basic communication, what is the best way to communicate with them? It would give you a lot of answers without figuring out the assessment, family members, the doctor as well. I even asked the doctor, what do you want? You want me to call at 2 a.m. or what do you want me to do? Because communication is key in everything else. So that's my tip. Find out what is the best way on how to communicate to your patients, to family members, and your team members.
Maritess, I think that's a great tip because that's really going to set your day up for success. I think for me, I don't know if this is necessarily a tip or it's just because I'm so like OCD type A, but I feel like it always sets my day up for success and just makes me feel more calm and organized is as soon as I walk in the room, assessing what's going on in the room and cleaning up. If there's trash, dirty tissues, empty cup, as I'm talking to the patient, asking them, how they slept, how their day went, what's our goals for today. I'm just pick, tighten the sheets, do all those little things. You need a clean gown. We got it. Getting the room and the patient clean for the day. Do you need clean sheets? Let's get up in the chair, brush your teeth. Just knowing that my patient is taken care of as a person before a patient just really helps me kind of calm my mind. And it gives you time to kind of look at them and be like, how is their mental state? Did they know what day it is? Did they mention that they were in pain last night? Because the nurse told me that they were in pain last night. Just the little things like that. I feel like you can learn a lot about your patient by just chit-chatting with them. And for you and for them, it can bring a lot of the chaos down. If the chaos in the room, that really sets your day off to a good start.
Sydney, that's great. I used to really, really get annoyed when I would walk into patients' rooms and they were just a mess. Like nobody bothered to pick up the tray or, leave trash on the overbed table, or if the patient just didn't look comfortable in the bed. So that was always a high priority for me too.
That's a night shift tip. Set day shift up for success.
Yes. We used to call those clutter rounds. Like just before the end of your shift, just pick stuff up. But for me, one thing that I always tried to do was make a personal connection with my patient. I feel like that created a springboard for the relationship that I formed with my patients. So I tried to learn something personal about them, what TV show they were watching, or if they were reading a book, or if there were pictures of their grandkids, or what did they do for a living. Outside of what they were there for in the hospital, I just wanted to know something a little bit more about them. And if they asked, I would try to share a little something about me. It just kind of gave us something else to talk about outside of nursing and their illness or their injury. The other thing that I always like to focus on is the fact that teach back is not just for discharge. So before I give them a medication, rather than me saying, this is your lisinopril for your blood pressure, I say, okay, this is lisinopril. What do you take that for? And it would let me know that they knew what they were taking their medications for. Or what do you understand about what the doctor just told you? I always kind of start there. Not only do I have a personal connection with them, and I feel like that helps build trust, but I always try to figure out where they were, what they understood about what was happening to them, and then I could help fill in the blanks.
Yeah, Laura, I agree with you there. I would always try to follow up. They would ask me questions, and then when the doctors would come in the room, they would forget their questions or be like, nope, I don't have any questions. I was like, wait, you just asked me 3 questions that you wanted to ask the doctor. So they're here right now. Let's make sure you get those asked. So that's a tip. Listen to your patients and make sure they get their questions answered when the doctors are in the room. If you're able to round with them, always round with them. My other thing is that I always liked to do with patients is when I would get them admitted, I would always ask, who will be taking care of you at home and how will you be getting home? So if they could answer that question on admission, I knew about how is this a discharge going to go, right? How long is this going to take? What is the social impact for this patient? Then I knew how much to involve social work and things like that. That's probably not a year 1 RN question, but it's just a little tidbit that I picked up along the way to help the patients and our unit and our whole process of getting that patient discharged in a timely fashion. Because if you wait till discharge day to ask that question, that's going to cause a problem, especially in social determinants of health of some of our patients. Then they're like, oh, I don't live with anyone and I don't have any keys and I don't have a car. I don't know how I'm getting home. I don't know. No one's there. And I have to give an IV antibiotic and I don't have a PICC line. And 2 weeks later, the patient's still in the hospital.
Neil, I think you're the last one.
I don't know if we say the best for last necessarily, but actually kind of like combines a little bit of everything what everybody said. Doing those small things and taking that time to ambulate somebody to the bathroom. When you start doing those small things, it builds that trust and you learn the communication. And guess what you also kind of do? You get a better sense of an assessment. Any patient could sit there and kick their leg up and say, oh yeah, look, I can move this now. But let me see you ambulate and not be in pain and not almost collapse. You can move a leg and show I have movement, but can you use it? What's your functional use of it? And so when you do those small trust building moments, that's when you have that small talk time to know how to communicate and build that trust. That's almost better than sitting there and doing this very rigid assessment. One of you said cognitive level. Are they really that with it? I think it's building that trust with quality, genuine interactions. Doing the simplest things will make it easier when you have to prep them for a surgery or you have to give them a new medication. They're going to trust you more because you're the person that took them to the bathroom when everybody else seemed too busy. I had a teacher the other day as a patient, and it was great because I connected. I said, I used to teach. Kudos to you. I just couldn't do it anymore. Her daughters were there and talk about like reading a room and the environment. I printed off both her daughters' discharge instructions because they don't live together. I said, if mom's not sure about something, here's 2 extra sets of discharge papers. So if she has a question, you have 2 other sets of eyes. The patient was so genuinely appreciative of just the simplest thing of printing off 2 extra things because it's reading the environment, picking up on the cues. So it's just really getting to know your patient because that will help get you over those borders and bumps that you might hit if they don't know you or trust you.
Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we've learned. With the variety of patients, it never gets boring. It's always interesting, and every day is different. Med-Surg nursing is not only a foundation exposing you to all types of patients, that diverse foundation also makes us the ultimate specialty covering so many types of patient care. If you love teamwork, Med-Surg nursing is one of the most team-focused specialties in the profession. Given all that we see in Med-Surg nursing, we're prepared to handle just about anything. And don't be so quick to give up on Med-Surg nursing. The first year of nursing is always hard. You will reach that turning point where it all starts to click. Marisa, any final words to our listeners?
I just want to say thank you to everyone for the years that I have been with AMSN as a president and as a volunteer. It's been fantastic, and I'm sure I will still be around volunteering and doing lots of things for AMSN in the future. And thank you to you guys for letting me be part of this podcast, and hopefully I'll be back again soon. I'll still be working with the fellows in the upcoming year, so hopefully we'll be back to talk about that. And so looking forward to continuing to listen to you guys, and you'll have Christy Regan Hartman on in the future. So thank you so much to all of you. Appreciate it.
To our listeners, especially all the nursing students out there, thanks for joining us. We'll see you next time. We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag Med-Surg Moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Maritess,
Neil,
Sam,
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.